Can infected but recovered patients be caregivers? Do they need any protection? And if professionals who are infected are willing to return, what is recommended? I hear from the New York Times you're heading back. Is that right?
Yeah, I would love to head back. I've got a little more to work on and get stronger. But it would be, even if I wasn't medical, I should go back and sort of be part of the burial teams or something, because I have very specific, strain-specific Ebola antibodies that are very, very valuable. Yeah. So I don't think we'll ever get to the point where I walk into an isolation unit in my scrubs and no PPE, just because the implications of that for everyone else are no good. But we'll need to understand this a little more. We think probably at least we're getting maybe 10 years of strain-specific immunity. There probably is some crossover of that immunity to other strains, as you know, with Ebola, but some degree of immunity will be there. So I'm much happier to go back actually now, to be interested. So I'd love to.
Jane.
When patients are starting to recover but have not yet become seronegative, so they can't be released yet because they haven't, the Ebola virus isn't, they're still testing positive for it, but they're feeling better, they sort of naturally come to be caregivers, especially for the children. And what we noticed was that, particularly for the children in the ward, anyone that was feeling better would start to become a natural caregiver. And so we had to figure out how you deal with that. So you don't want to put either patient at risk, but the idea that a child could be held and bathed and comforted when they're crying is so great. And so they're starting to get to the point where the protocols are coming in place of what's the right protective gear for somebody that's supposedly immune protected. What kind of testing is necessary? Should they be tested for antibodies monthly or quarterly so that you're sure that they're still protected? And so those things are starting to take place, and we're starting to have caregivers that are choosing to work in the facility and to stay. They're asking to become employees so that they can continue to care for patients. And I think I think the act of solidarity is hugely compelling, and I think it will have a big difference. It'll make a huge impact on the patients. And so I think that that's one bright spot.
Yeah.
It's really great.